Many parents from families where there's hereditary depression who have a depressed child say to me, it's my fault my child's depressed. They blame themselves. They are aware of the deficiencies that we all have because none of us are perfect parents. But what's important in that situation is to be able to say, look, it's probably this inherited tendency that's caused the depression.
I do want kids. And I think if our kids have depression, I guess I would want to talk to them about it and be open and not have this kind of shadow that it's like something dark and shady that you can't talk about.
In families where there's hereditary depression, it's very important that there be open communication about this. One of the issues that comes up is, at what age is my child ready to have that discussion? I think that's not an easy question to answer. In general, I'd be suggesting that the child should be mid-adolescence or older. However, I think children vary.
He's not as outgoing as he was, and because of the family history, I can't help but worry. But I have to stop myself worrying because that becomes an extra stress on him. He'll say, Dad, what's your problem? And if I start saying, I think you're developing a depressive illness, he'll go, no, what do you... So I just watch and I try and give him his space. And I might suggest we go on a bike ride on the weekend or something like that. And I might take him for a long, healthy ride and then make sure he gets well fed afterwards and before sending him off to one of his parties to drink with his mates or whatever they do.
If you suspect that a young person might be at risk of depression, it's really important to actually have that checked out early. And I'd suggest that you try and make an appointment with a Headspace centre, which are new youth-friendly services, which I think probably are less stigmatising than general practitioners for young people, because they offer the whole range of help across physical and mental illness.
Most parents do a good enough job with their kids. We all worry too much. There are clearly examples where some kids are abused, and that can lead to depression in the child. But I think it's fair to say that if you're intending to do a good thing by your child, you're spending plenty of time with them, and you're aware of their needs, you're probably going to be okay.
For middle-aged people or young adults, I think a GP is a very accessible way of getting help. And if we can encourage people to go and see their GP early, then it could make a radical difference. The analogy is something like hypertension. Nobody would say you shouldn't go and see a GP about hypertension, which is obviously putting the person at risk of developing a cardiovascular disease later on in life. It's the same thing. If you think that the person has symptoms or they identify they have symptoms themselves, why not just go and check it out before it goes into something that could be a lot worse?